And good and welcome to Great Talk, your drive show. And this is Tyson, your host. Welcome to Monday. Where did the weekend go? This is crazy. I literally think that I blinked and the weekend was gone. So work with me, people, right? Yeah, who's just kind of getting going for Monday. How are you guys feeling? I hope you're doing well. Thank you so much for tuning in this afternoon. It is Medical Mondays, and you know what Medical Mondays means? That Health City is in the house, and they are bringing all of the good stuff that they do all the way in the East, the beautiful East where you just drive and all troubles melt away. And by the time you get to Health City, you are so ready for whatever it is that they're going to do. And it's just fabulous things going on. So, Medical Monday today, we have a couple of guests that have come down from Health City as usual, and we will be chatting with them in a little bit. Now, if you wanted to call and join the conversation, 9433700. I would love to hear from you this afternoon, as well as you can email us at straighttalk at star927.kman.ky. Daily motivation for today: take care of your body. It's the only place you have to live that really matters. I added that really matters to the end of that. That was from Jim Rohn, and that is a quote. It is the only place you have to live that really matters. Because you know what? At the end of the day, when you don't take care of your body, it doesn't matter what you have. It doesn't matter how much money you have. It doesn't matter what a beautiful house you have. It doesn't matter all the great job, the great. It doesn't matter if you are not your best self and feeling your best and taking care of yourself. It is a sad place to live. So today, Medical Monday, that's what we talk about with the people from Health City, about taking care of that body of yours and ensuring that it's going in the right direction and that you're feeling your best, right? So thank you all so much once again for joining this afternoon. I can tell you what, I am so happy that, Monday is over and we have a short week this week. I'm excited about that. Also looking forward to Wednesday, which will be a nice holiday on Ash Wednesday. I don't know, those days when you just get up and you're just tired, you're just exhausted. It's one of those days for me. So, yeah, excited to be here to talk with the Health City people. That should perk me up, I think, definitely. So, thank you for tuning in. This afternoon, we have in our studio this afternoon Tiffany Dixon Ebanks, who's the Global Sales and Marketing Manager, as well as Miss Marcian. They're going to say their name right in a minute. Jumana? Jumana. Okay, they're going to tell us. They're going to correct it. She's the front of house manager. And this week on the Showcasing Medical Mondays, what they're doing is actually showcasing one of our talented managers and the impact that they have at Health City. So, ladies, good afternoon.
Good afternoon, Catherine.
And well, no shyness in here. You're all going to talk, especially okay, because somebody is losing their voice a little bit, so I get it.
I hope I last the hour. So I think we were in here last week with Dr. Run and Kaylee as our dietitians, and I think that's a nice segue. New year, nutrition, executive health, and so we spoke to the doctor, we spoke to the dietitian in terms of, ensuring persons remember their New Year's resolutions, take care of their health. And near the end of last week's show, we talked about how do you go about setting up your appointment, send your information to info@healthcity.ky, and get that in line set up for you. And the team of people who you're going to encounter when that happens falls underneath Marshini's direct supervision. So as our front of house manager, we thought it was so good to showcase her her management skills and the team that actually welcomes patients to Health City. What is the day-to-day like? What do they do? How do they manage ensuring that there's exceptional service? So I gave you a little write-up of her. I'm not sure if you do want to do that or if you want me to kind of indicate a little bit of that to the listening audience. You tell me,
I
Catherine.
mean, I can. It's fine. So let's get the name right first. It's
Yes.
Marshine
Yes.
Juman.
Juman.
Juman. Okay. Marshine Juman.
Yes.
All right, great. So hi. Say hi to the people.
Hi, everyone. Thank you for joining in.
Thank you so much. Okay, so yeah, I can read a little bit about that. Just just to introduce Miss Martinet Schumann. Okay, front of house manager Martinet is responsible for overseeing a variety of projects while supervising the front office team to deliver excellence, which you guys do, by the way. Gotta tell
Thank
you
Thank
you.
that
you.
your
Thank
team
you.
is awesome. From you walk through those, doors that just open for you, it is sunshine. That is the truth
Thank
for
you.
sure. I've never seen you though, so whatever you're doing is you got your
Always in the
team
back trying to arrange with the patients and
represented.
everything. Yes.
Absolutely. So this involves the attention to the promotion and provision of outstanding customer service, and the team is tasked to remain calm in a crisis, act quickly while still maintaining daily clinical functions. We will talk a little bit about what it is you actually do, Marcia. I think you're the best person that can tell us that. But I think that's really important, right? That you are from start to finish. That's your team. So even though when they get beyond your borders, type of thing, they're dealing with the medical aspect of it. All of that other admin stuff is so super important, and to ensure that that's going smoothly. Yes. Now you also have a very kind of great vast career behind you, and what I did see was you're an actual accountant. Yes.
Yes. I used to be in the audit department at Deloitte,
Okay.
and um, for 3 years, and I decided, well, you know what? I wanted to transition into something that gave me a bit more purpose and allowed me to actually give back to the community, especially the people of the Cayman Islands. So I decided to go get my master's in business administration and returned and just joined the Health Services Authority before joining the Health City family.
Okay, and so you've been at Health City about 5 years?
No, I'm actually there nearly 3 years.
Okay,
Yes.
all right. So nearly 3 years, and you started off in one position, and then you went on to the front of the house, or were you in that position the whole time?
No, I've actually been in front office, managing the day-to-day operations, and they've given me a bit more of the workload as, I've shown my capacity and my competency, I guess. And so I oversee about 7 different departments, which include the diagnostics area, reception, porters, appointments, clinical secretaries. So, when you've gone to do a procedure, you need those medical notes that clinical secretary takes care of that. The
Okay,
outpatient department, where you go and see the doctor, as well as the surgical department, where if you need to do any procedures and whatnot, the patient care coordinators that deal with you, I oversee them as well.
okay, all right. So, and I mean, it does sound like a pretty big job, and you look like you're a little young. At least you look young, which will work for you. I always tell young people it'll work for you. Don't worry, it'll work for you in the future, right, Tiffany?
Yes. Yes.
Right? But definitely, what would you consider that? You consider that it's a huge undertaking, like every day, having to deal with so many different teams that are delivering different aspects of the work.
It's definitely a challenge, but it's one that I love. I love to go in on a fresh note every day and a positive note because if you do not bring that positivity and a service with a smile approach, you're not going to be able to radiate that through your team and help build and pull them on the days that are not so easy, as I like to say. And you definitely want to have that team approach. It's not just a one man show. Everybody is very important to the success and the service that we provide, which is we want to care to excellence, basically.
Right. So how much interaction do you actually have with the medical staff?
It's quite close, actually. I oversee the doctor's scheduling as well in the outpatient department, so it does take talking to them daily, just handling any issues that they may have, any concerns or any recommendations, because at the end of the day, we're always looking for ways to improve our services. And sometimes that may come from stakeholders such as the doctors or the patients and your own staff as well. So it's quite intense. It's basically every day.
Okay. Now I see that you also went to the University of South Florida. That's USF in Tampa, right?
Yes, I did.
Okay. And so where do you hail
Originally, I'm from Ghana,
from?
but I grew up in Brac since I was 6 years old, so I'm
Okay.
a
Ah,
Braca.
okay. And so you finished all of your high school and everything in the Bronx?
Yes, I did.
Right, and then you get straight on to that's where the Tampa connection is because I know the Brockers love Tampa. Caymanians love Miami,
Mhm.
but the Brockers love Tampa. love it. So that was, that's I'm kind of making that little connection there. All right, so you've been a part of the community a very long time,
Yeah,
which
since
is great.
92.
Yeah, which is great. So, what would you think is the most maybe challenging part of your job? So you manage about how many departments? You mentioned
7.
maybe about 7, yeah?
Mhm.
And so which one you think, I don't know if they're listening. I'm not gonna ask you
They're
what the
listening,
best
Marcia,
one
they're
is.
listening.
You're all the best. Which one is like maybe something challenging that we might not know as customers, consumers, or patients, but that you were kind of like, you have no idea what this takes to ensure that you guys see the smooth running.
Well, you know what? I like to think reception because reception is the face of the organization and they have to endure so much. They have to endure when you are not feeling well and want to take out your anger on them. They have to endure when they're seeing patients who are a bit sad because maybe perhaps their loved one is about to pass. They have to see people who are they're not necessarily able to help directly, but they feel like our family, and they have to take that energy and just kind of control it and still give the same positive um, interaction to each and every patient that comes to the counter. And to me, that takes a certain skill, and not everybody can do that. And that is what I love and appreciate about my team. They have that energy. They try to keep the momentum going no matter what happens. It could be something that totally throws them off, but they'll take 2 minutes or 3 minutes, take a breather, and just put on that smile and cater to the needs of the public.
That's good. That's good stuff. My mom had a surgery there in December. And so
Mhm.
I've been very familiar with Health City. I've been just raving about it just because I think I went and did the executive health
Health
check
check, yes.
last year sometime. A friend of mine, I had seen her working and she lost some weight and she looked really good. And I was like, hey, what's going on? She says, oh, I did this executive health check. You need to go. And so, of course, I kind of put that on the list. And so I've been interacting directly with Health City. I've had patients that I've visited over the years as well.
Mhm.
And then my mom had a surgery last year. And what I found, especially with the admin team, is just how much they kind of go above and beyond. They go out of their way, which is great. You don't have to ask them to help. They're willing to help. They're willing to, just make the experience just flow easier. And I appreciate that. And I want to tell you thank you for that because I'm interested in Caymanians just really being developed in their own country, absolutely. And I find that the admin team is it's a large local part of the team. Because mostly the doctors were all Indian, it seemed, I think, as well as nurses. But the admin team, there seemed to be a lot more local people and Caymanian people, and so I really appreciated that. Now, is that deliberate?
Well, we like to have a balance because, we're in the Cayman Islands. We want to make sure the people of Cayman are feeling like they're welcome in their own home. They're not in some foreign place, and that see friendly faces. And we definitely want to invest in humanities here as well. We're here to ensure that they can grow and develop, and if they want to go into the medical field, we would love to develop them further to go into that medical field as well.
Okay, well, that's good. That's really good. So, in terms of your day-to-day stuff, can we talk a little bit about some of the things that you do day to day? Just specifically, since we're here highlighting you and what you do.
So my day to day is basically ensuring that the patients, their touch points are minimized. So the patient path flow through the hospital, whatever we can minimize to ensure that they can get to see the doctor as soon as possible, we do. So whether it's tweaking if they do billing after the service or before, or maybe they can do vitals on their next visit, little things like that. It's also looking at the various aspects of the departments and just jumping in. Sometimes, as a manager, you feel like there's so many different things you need to do behind the computer, but honestly, the most important job that you have to do is just to be on floor with your people
Okay.
and just jump in and take handle of situation and make sure that you equip your staff to do the same as well.
All right. So you also that would also deal with the insurance process. You deal with that as well.
I do. Our outpatient department actually has to file for any insurances to do, say, if you want to do an MRI, the doctor says you would like to do an MRI of your knee. we actually have to put the insurance on, get it approved. So we go to our insurance department, we get the paperwork, we get everything sorted, and then we communicate this to the patient. Because at the end of the day, communication is quite important. It may take 3 to 5 business days, and we want to ensure that the patient doesn't feel like we've forgotten about them or that they're not important to us. So the relationship we have with the insurance department is quite close. They're even contacted after hours, so we have to be best friends with them to ensure they respond to us whenever we need them. And just providing guidance to medical terminology or just clarification with the notes. They're also there.
Okay. And so that would also, I guess, that would have to do with your admission process, right? The insurance, those are very connected, yes?
Well, the admission deals with like any surgical procedures that you may have or anything that needs to do go under anesthesia. So that is usually more towards our inpatient care. But yes, if the doctor does decide that, you know what, if you need to do the MRI but you're claustrophobic, we would have to put you under anesthesia. And then yes, they would put it in the notes, send it for insurance approval, and then we would book you for an admission.
Okay. Now, you said earlier that you deal with the notes. You just mentioned that again.
Mhm.
So your one of your teams actually deals with inputting the notes?
No,
Yeah?
we actually have to read a doctor's notes and make
Okay.
sure that whatever they have advised, we action it. So whether it's perhaps physiotherapy or it's an X-ray or an ultrasound, we send it off, we book the patient, and then we book a follow-up appointment. So we ensure that there is a continued care.
Okay.
Mhm.
All right. So yeah, I guess there's not too much downtime for you when you're on the job. So what does a typical day look like for you?
Well, as soon as I get in, I'm just ready to go. I check on the patients in the lobby, I check on the reception staff, and I try to say hello to all of my staff. Then I go and sit down, check my emails to see if there's anything urgent that I need to action. Well, to be honest, I actually check it before I go into work,
Okay.
just because I have a little bit of an OCD and I like to see everything clear within a certain time frame.
Okay.
And then I actually go and check with the doctors to see if they need any assistance or if there's anything that needs to be urgently actioned. Because with all the different moving parts, sometimes it's not as easy for the patient care coordinator to do something right then and there. So I'll jump in, I'll take care of it. Then I'll also like with senior management if they have any meetings or any urgent items they also need to get action or they want any feedback. That's where I come in as well.
Okay. And so I'm reading here on some of your general duties, assisting department heads as needed for smoother operations. And so that would be, oh, every department head.
Actually, yes. Because I don't oversee the insurance department, so I actually go to the touch points, the heads of that department. Billing is another one that we interact with very closely. Pharmacy as well, because patients will say, "Oh, I'm not able to get through with this. The pharmacist, can you contact them?" Or I need refills. So we have to coordinate with the pharmacy department quite often, and also in the clinical aspect, the board nurses and doctors. So it's not just oh, we're just front of house, we deal with patients on the front. It does not go to that level. We have to transcend where we get the patient in, they're our patients. We
Okay.
take ownership of their care and we make sure we check on them a little bit later as well.
Who calls you the most? Which department calls you the most?
They take turns.
Today, whose day was today?
My supervisor, he was having a little bit of a rough day and he was calling me and I was just like, just, walking him through a few things because this is his first time. He's pretty relatively new and I like to provide him support.
Right.
So
So you have all the information.
I'm always open to learning more.
Okay. I mean,
And
for him, but yeah, it comes to you because you've been there longer than him, yes?
yes,
Okay. That's good. So you guys must have kind of a good relationship that you're walking hand in hand, right, to deliver. And so who is that you answer to
I answer to the general manager.
then? Okay.
So
All right.
mhm,
So the general manager of the entire health city, yes? Okay. And so you're front of house. And so who who works alongside you then? So do you have a supervisor that's under you? Do you have someone that's yeah? So who do you manage? How does your team look?
So we have a supervisor. He's relatively new, as I mentioned earlier. We also have a referrals and emergencies manager. She's under me as well. And then we have a team lead. So we're trying to take a young Kimani and build her up so we can help her have this growth in organization, kind of do the succession planning as well. And then we have the patient care coordinators.
Okay. And how many of them do you have?
It's a team of 27.
Oh, wow. Okay. A team of 27 patient care coordinators?
In total, across the
Okay.
Mhm.
All right. So there's one for each department, or there's a couple for each department.
Yes, a couple for each
Okay.
department.
So about how many people, how many staff is that are under you that you supervise, that you manage?
It's about 30, 31.
Okay. All right. And so you would have like your regular meetings, like weekly meetings or something that everybody can't get together at the same time, obviously, because a hospital has to run. So yeah. So how do you do that? How do you
Usually, I try to work in with departments because it's a bit difficult, as you rightly said, to get all of the departments together for a team meeting, especially when you have a department that runs 24/7. So I usually have to ask a favor from another department if they will cover for my reception area, for example,
right?
while we have a meeting. And we usually try to have those monthly. And if something arises that I think is of importance, I'll have it, at the end of the week or whatnot. And I try to, when I have these meetings, I try to provide a bit of encouragement, good feedback, and also what we can improve on as well as a team. Because as I said, it's not a one-man job, it's everybody's job.
Right. All hands on deck.
Yes.
As they say, right? What would be what do you think is your busiest day? Is there such a thing in a hospital as the busiest day or a slowest day?
Yes, we actually do
Okay.
have those. Tuesdays are usually the busiest days.
Really?
Granted, today was very abnormally busy,
Really?
which we can't complain about. We love it. We,
Right.
we love to
Busy's
drive under
good.
pressure.
Okay, but Tuesdays generally. Yeah. And so which day then would be like a little slow down day?
Wednesdays. Yes.
Okay.
It's
Then
kind of like and gives you a little like, okay,
everybody's
breather.
called in Wednesday. You don't need to talk. Like I'm gonna stay home, get a little rest.
If there's like I know you're asking but if there's a relation between hump day
Yeah. I'll
and
just tell you why.
yeah, exactly. Definitely.
No one's going to the hospital. They're
Yeah.
home trying to
Yeah.
heal myself.
The rest of the week.
Yeah. You know, there's a lot of credit kind of, put towards mental health, right? Just like, we talk about Wellness Wednesdays here, and I really focus on mind, body, soul, spirit, everything, right? And just how it all works together, right? And if people were happier where they worked or happier working, then it would be so much less kind of, illnesses that do manifest themselves physically. I mean, we're not trying to put the hospital out of business, but just trying to look at, what would really be just better across the board, and just having the hospital as a resource is incredible, which is amazing, but also just looking at how can you live your best life, right? While still having this resource. Like I said earlier, take care of the body. It's the only place that you have to live. So that matters for sure, right? So you're listening to Medical Mondays, and this is brought to you by Health City. Every Monday, Health City people come out and talk about all of the great things that they have going on in the East. And this week in particular, we're talking to Miss Tiffany Dixon Ebanks, the Global Sales and Marketing Manager, who's brought along with her Miss Marchene Juman, Front of House Manager, and showcasing what Miss Marchene does every single day. As you can hear, it's a lot of stuff. We will be back with more, but you guys don't go anywhere because we're talking to Health City, and this is your Medical Monday show, and we have lots more. So stay tuned. We'll be back with more Straight Talk. Health City people that have come down from the East. They sponsor Medical Mondays. And so the show is brought to you by Health City. Thank you so much for joining us again. We are talking with Miss Tiffany Dixon Ebanks, who is the Global Sales and Marketing Manager, as well as Miss Marshane Juman, who's the front of house manager. We're just highlighting really, one of the talented managers at Health City and the impact that they're making. And they started with Miss Marchene. I imagine, Tiffany, you're going to be bringing some more people.
Well, we hope so.
Okay.
Actually, we meant to bring another person this afternoon. It didn't quite work out, but hopefully in future we'll get more on. As you know, Health City has been doing this show for several years, and many of the doctors have come on the shows. Several times, talking about varying ailments. It is a health show, right? So you're looking at medical conditions, and a lot of the local audience, as well as we do have international listeners now, are trying to hear, little tips and tricks on these medical ailments, what to do, what not to do, and stuff
Right.
like that.
Right.
So we really, I think this is the first time, I'm not sure, but since I've been at Health City anyway, that we've brought Marshani on as front of house manager. It's a good it was a great idea. Now, in the business development team, maybe my boss Shamari, maybe it was his idea, but I don't recall. But
It could have been yours.
it could. No, I won't steal it. It was not my idea. But I think it's a good idea to showcase those persons at Health City who don't normally come on, the persons like Marshani who are busy, day to day, actually coordinating the teams that actually welcome the visitors, that actually take the appointments, that actually have to follow up on the appointments and ensure that patients know where to go. One thing that we didn't mention earlier in this show, which is something I was kind of proud about Health City doing, where they assign you come in, you're a patient, especially if you're coming for the first time and you don't know where anyone is. Marshani or someone on her team will be assigned to ensure Mary Sue is here. Mary Sue needs to go to OPD, needs to go to diagnostics, needs to go to physio. And that person would be assigned to bring the patient in and show them where, kind of like an usher,
Right.
where they need to go so that they can navigate navigate the areas in the hospital that they need to go. It can become a little bit tricky sometimes, especially if you're visiting Health City as a patient for the first time, right? We try to have our signage in place. Actually, I'm part of the team now that coordinates a lot of the signs at the facility. So
Right.
I understand how important it is, but it's always good to have that human touch. That
Right.
sign is on the wall, it's static. But if someone is able to lend that additional customer service, and it's kind of like your medical tourism escort into our facility,
Yeah.
it just makes it that much better for the person. It's not that you're not they're looking at a sign, this is where you need to go, but that personal touch sometimes just makes everything that much better for the patient who's not feeling well,
Right.
right?
Absolutely.
You're not feeling well. So you sometimes just like, in a regular situation, it would be great. But in a situation where you're not feeling well,
Just make it easy for me.
that is just appreciated. It's just human,
Absolutely.
right?
Yeah. I mean, generally, when you go to the hospital anyway,
Mhm.
it's because of something. It
Right.
may not be a huge thing, or
Right.
it could be a huge thing. But either way, the last thing that you want to be thinking about is trying to find your way or trying to figure it out on your own. So to
Right.
have somebody really just make that process seamless, it's
Mhm.
amazing because that's one less thing that you have to think about. And as you were speaking, Tiffany, I was just thinking to myself, and I'm only here to highlight Health City. That's what we're doing on Mondays. We're not highlighting any other hospital. We're highlighting Health City. But when I compare to the other hospitals, you guys have made it so easy to check in one place. And there's a starting point at
Mhm.
this one place, and that starting point is what takes you throughout your visit, your stay.
Mhm.
I love that because I think when you are kind of like twisting around, trying to figure out where do I go, who do I talk to, do I turn here, do I
Mhm.
stop here, Health City has made it made that whole process so simple because you literally walk through these one doors and you go straight to that place, you check in, and those people are who direct you from
Mhm.
there. That was smart. Whoever did that, and I just think about what we have on island in terms of our health facilities. That's really brilliant. And I think that is just really taken the guessing work out of it. Like I said, my mom had surgery, back surgery, actually, last year. And it was so simple. Like we walked in, I was scared. It's my mom.
Understandable.
And yeah, everybody goes through all the risks with you.
Mhm.
And, there's always a party that's like, oh my goodness, is she going to be all right? And I hope it's not the last time I see her. It's just all those things going through your mind. And when somebody can kind of go, no, we fine, come on, and just take that stress away from
Mhm.
you, that just allows you then to be relaxed, be with your person, and know that you're in good hands and
Mhm.
just trust and have faith and know that it's going to be okay. But that kind of intrinsic details and admin part
Mhm.
is not yours to worry about. And I really like that. So I think sometimes when we think of a hospital, we think of the medical staff, but we don't think
Mhm.
of what makes it all flow, what makes it all happen. It's like getting in a car, turning on that ignition, it turns over and you put her in drive and you're gone. But there's all those little things underneath that hood. And if one little wire is disconnected,
Yes.
that little ignition that you turn will
Come to
not
work.
turn that engine over, and you will not be able to put that car in drive and press that gas and move. So it's all this coordination that's happening at once, and no one's really seeing that part of it. So you're right, Tiffany. It's really great that you brought Marchene in here to talk about that because that's big stuff. That's big stuff. So you're a little woman, but you got a big job. So yeah, how does that feel?
You know what? I love it. I love every bit of it. As I said, I love the challenge. I love the thrill to just go above and beyond. I like to think of our patients as family members. When they come in, they're not just a number. They're not just a patient. They're our mom. They're our dads. They're our aunties, uncles, grandparents. And
Absolutely.
at the end of the day, how would I want my family or myself to be treated?
Right.
And that approach is how I try to train my staff to deal with everyone because you never know. They don't come here because they want to come here. Okay,
Right.
let's be honest.
Right.
They come because they're either ill or they're experiencing some weird symptoms and they really cannot explain it themselves. And when they come through those doors, they want to know that they're reassured that they have come to into good hands and that they will be taken care of.
Yes.
And that is what we strive for. We strive to have that empathy, that calmness, that trustworthiness as well, to know that they come to a safe space, so to
Yeah.
speak, and they can be taken care of.
Well, I think that's it. What you just said, that's key. They're in good hands. Now, before the break, and think during the commercial, we talked a little bit about touching on mental health
Mhm.
and taking care of your entire self before you something is physically manifested, but the whole body. And I think you wanted to chat a little bit about that as well, Marchene.
Yes. Mental health, I feel, in the Cayman Islands is just such a taboo a topic. There's a negative stigma with it, and I feel that there shouldn't be. We should be able to talk about things that are bothering us. We should be able to have that open dialogue, whether it's with families, with coworkers, with your boss, because ultimately, if you're not discussing what is troubling you, it's going to manifest into something internally.
Right.
And internally, it's a lot harder to diagnose and it's lot harder to treat, especially if it's in your mind.
Right.
And we cannot always control our thoughts. So it's really good to have a bit of an outlet. And, Dr. D. Walker, he's our psychiatrist, and he's very good with just being able to help calm patients, just get them to open up. Patients that you would never know had any issues or any concerns. They come, they just have a consultation, and it's very confidential. We actually do not have access to those notes. It's just need as you go. so to speak. So if people of Cayman, because Cayman is quite small, let's be honest, everybody know everybody, everybody family down here. So it's very important to know that your medical notes are secure and they're held in the utmost of confidence.
Right. Absolutely. I mean, and that should be a given anyway. So that's good to
Hmm.
know, for sure.
I also just wanted to. One of the things that we you did mention in the break, Marshani, was there are persons who might because of the taboo nature of everything,
Hmm.
they might shy away from wanting to come into the hospital. So we do have an alternative. You want to talk
Yes.
about that?
So we do have teleconsultations, and this gives the opportunity to patients who may not be mobile or may not want to leave their house because that might be their fear. They're able to just send an email to us, info@healthcity.ky, and request an appointment with the psychiatrist, and we'll be more than happy to set it up. The doctor can call, the doctor can do a video chat, whatever is most comfortable to the patient, the doctor will accommodate, and then they can go from there.
Okay.
So that is what we try to encourage our patients to utilize whatever means is necessary for them to get care.
So you have, in other words, you also have a mental health department that is willing and able to assist in that area as well. Yeah, to provide some service in that area as well.
We don't have an official mental health department as
Okay.
yet. Maybe it's in the future, who knows?
Okay.
But we do have the psychiatrist who's able to provide that firsthand support. And if there's further tertiary care that's needed, we can refer it outside.
Okay.
Hmm.
All right. Great. Well, that's good to know. I think that's something that maybe people did not know. So that's good
Hmm.
information. So let me ask you. You told us about the busiest days, the ones not so, a little slower. What about a common thing? And I ask most of the doctors when we do talk from Health City, what are some of the common things that you see that are kind of common complaints then? Do you guys do like statistics and stuff because you're an accountant, so I'm expecting that you must put together some type of report or
Hmm.
reporting to kind of see what's common, what are things that keep coming up, and in order for you to best provide for for patients as well, right? What are some of those things that you think that are kind of common, especially for Cayman as well, for Caymanians?
Well, the thing is, for Caymanians, we tend to be a one-stop shop, and we tend to be impatient at times, you know? So we want to know we can get in. Our time is quite valuable. You can't replace it. So you want to get in, see the doctor as soon as possible, and get out, right? So one of the measures I am constantly monitoring and trying to find ways of improving and minimizing is the wait times.
Okay.
And that is something that you can have a great day. Things go well, patients see their doctors on time, it's smooth. And then you can have a day where the doctor gets called into emergency surgery. Now, we are a hospital, so I cannot say that's unavoidable.
Right.
What we can do, though, is just make sure that we are communicating with the patients, giving them the option to be rescheduled or give them the option to wait. And sometimes, if the doctor is in the surgery a lot longer than expected, I do try to offer them something to eat or something to drink just to kind of tide their time over and make them feel a bit more comfortable.
Okay.
So,
So you think the need or the want for things to go a little quicker is a common thing?
yes, I think that's why they come and choose Health City.
Uh-huh.
It's just because we're able to get a lot of different things done within one
One
day.
place
You don't
in one
have to
day.
go to different
Ab-
areas and
Absolutely.
come back the next day. You can just do your MRI the same day if you want,
Right.
the blood
That
work
is
the same
so
day.
good.
So,
Yes.
same day service.
That is so good. And if people are coming there impatient, it's because you just got them spoiled. Because I tell you what, they got to wait other places, sometimes for days. So don't mean to be laughing about it, but it is the truth. And it's really good, like you said, that you can get that level of care and
Mhm.
get results back, get
Mhm.
information back within this short time frame. Because I think the biggest thing for anyone who's experiencing something when it comes to their health is wanting to know, what is it? I
Mhm.
don't want to wait, because the wait sometimes is the thing that drives you crazy, because you're thinking it's everything. You know what I mean? Like I'm
Mhm.
I'm the Google doctor. if I feel if my
We do it as
if
well.
my elbow is
You're
hurting
not
me,
alone.
I'm googling what's wrong with the elbow, and if I'm trying to explain it in the exact words, so everybody does that. Is that like a thing? Okay,
I know I'm famous for it. Like,
I do it too.
okay,
not coming from a medical background, there was a steep learning curve, and
okay.
I love knowledge and I love to learn new things. So when we're reading notes, there's a lot of terminologies I don't know.
Right.
So Google is my best friend.
That's
I'm
right.
googling and
Go
I'm
look
like,
that
okay,
up.
I'm applying and seeing where it fits, and
Of
then you
course.
learn something new, right?
Of course, you
Mhm.
do. You really do. And you're kind of in control of your own care,
Hmm.
And so I think, yeah, definitely. I love the fact that you can get into Health City and just get that information so quick. And there's so many, um, just the resources that you have in house is invaluable. Yeah, you're proud of your team, I imagine, huh?
I am very proud of my team. I mean, there are days when we have it rough and there are days when we have it great. But at the end of the day, I wouldn't trade them for the world.
Absolutely. Now, on this, I want to say on your general duties, I do see this thing that I wanted to ask you about.
Hmm.
It says you balancing the needs of the patient and the hospital. Now, that must be a gentle dance, right? Because the hospital is business and business
Yes.
Mhm.
must run, but
Mhm.
then the patient is not a number.
Hmm.
And so, how do you feel you do with that?
I like to think we're doing a pretty good job because if you look at the wall outside, Dr. Shetty does have a plaque out there, and it says that we provide exceptional care at an affordable cost. So I like to think of our patients as I said, family while we're running the business. So we're sort of like a family business.
Yeah.
And at the end of the day, I constantly meet with upper management just to understand what their objectives are, how we're trying to reach them, maybe redefine the approach and the policies in place while having the patient at the heart of the discussion. So when you have the patient at the heart of the discussion, you're able to better centralize that care while balancing the needs of the business.
Okay. I had
Hmm.
another question for both of you ladies.
Yes.
So, with what you just said, does Health City, working at Health City, does it actually feel like family? Does it?
I think so. We
Yeah,
spend a lot of our time there, to be honest. We spend at least 75%. Well, I spend at least 75% of my
we do
time.
all spend
So,
a lot of
Okay.
time there.
Right.
and, sometimes you may want to look at a person and be like, don't like you too much today, but I
Just
love you
like
tomorrow,
family. Just like
and
family, right?
exactly.
Just like
But we
family,
all
yes.
pitch in whenever there's a need. We all get together. We all come together, and it's a beautiful journey when you witness that happening, and we just help each other and support each other.
Do you guys get all of your services for free, or do you have an insurance situation that you have to go through? Like, what happens when you're sick? What happens when you have needs? I think that's a good question.
It
Oh,
is.
well, we
Yeah.
we do still have we have to be
Mhm.
as an employee in the Cayman Islands. Our employer is Health City, but we still have to have our insurance in place.
Okay.
So just like everybody else, you go to the hospital, you have your insurance and your coverage and
Okay.
so
So
on.
that you don't just get like back surgery for free and stuff like
Oh,
that.
no.
No, but we do have the perk,
We'll
I
talk to
must
Yeah.
Dr.
say,
Shetty
that
about
we
that.
we actually get that little wave off. So if there's like a copay, we do get that waived off,
Oh, nice.
So
Okay.
it's
Yes.
a little bit
A
of
Good.
an
little bit of perks
incentive.
there.
Yes, that's good. That's good. That's definitely a good thing. Yeah, for sure. I was just wondering because you obviously would know all the doctors and know
Yes.
who to go to, and while they're
we
doing
we
their
still make
stuff.
sure we follow the processes. At the end of the day, we still have to adhere to certain guidelines, and we don't want
Yes.
to overstep, so to speak.
Okay.
And
Keep it.
overburden our
Yeah.
system. I think one of the things as well, I know we've preached this over and over the years that we are JCI accredited institution, which
Okay.
is,
Mhm.
one of the highest, the global standards for um, accrediting healthcare. And
Mhm.
so when Martian is balancing the needs of the patients and the hospital, you also have to take those compliance issues into account as well. There are certain things that are in place that you strive to do and achieve and maintain because every 3 years we are going to be examined by
Okay.
JCI for our refreshed accreditation.
Okay.
And so we want to also ensure that we are consistent with our service delivery, our quality of outcomes,
Mhm.
our KPIs, our key performance indicators. It's very important that we manage that process as well, so that we maintain our accreditation.
Okay. All right. Now, does any patient get turned away, Marchine?
To be honest, we try not to. Even if they don't have cash, we try to work with them.
Gonna work something out.
So I like to tell people, especially we have a triage room that's 24/7, and a lot of people don't know that. They think that it's just like one main hospital that has that service. And I like to say no. We offer that if you feel like you're having any cardiovascular issues and you live in East End, feel free to come.
Or
Make
up
sure,
that way.
yeah. If anyway,
Right.
and bring your ID, bring your insurance, or get a family member to do something of that sorts. We don't look at it right away. We will look at it afterwards. We will
Okay.
take care of you first because your needs and your health is what's most important to us.
All right.
And then the finances we can figure out after.
Okay. All
Hmm.
right. Now that's always good to know,
Hmm.
because some people are afraid they don't have insurance, they don't have, a lot of money,
Hmm.
and sometimes they stay home and they get worse. And, when things could have been nipped in the bud early,
Hmm.
because of that fear. So that's always really good to know and to put people's minds at ease. What is one thing that you want to brag about? Health City. What's that? What? Maybe there's a lot of things, but I'm gonna give you just a couple of seconds to brag about something at Health City.
Trying to choose one now.
Yeah, I know. Choose more. That's fine. More is good.
Our attention to detail. That's what I think makes us a bit different is that we go to extra mile to take care of our patients. Whether it's taking care of your family when they come in with you and making sure they're comfortable, or whether it's a follow-up call just to check on you maybe a month, 2 months later after you've had surgery, just to make sure that you're healing as you should be. And just that compassion that we show. I feel a lot of places they're in it for various reasons, and sometimes we lose the purpose of why we got established in the beginning. And the healthcare service with a smile, excellence, it should be at the heart of everything that you do. And I believe that is what Health City embodies, and that is what we definitely exemplify.
All right. Now I'm looking at some stuff that I found online and
Hmm.
and some things that I can help brag about for Health City,
Okay.
right? Overnight stay for patients, visitors, light-filled waiting rooms with comfortable furniture and a calming design,
Hmm.
four-star multicultural dining facility, which is the truth. The food is awesome, right? My daughter went to school with Vidyara's daughter too, by the way. So I've been
Ah.
yes, yeah, Blue Cilantro. So I've known them for a very long time. On-site registered dietitian to customize meal plans based on
Hmm.
dietary needs. For example, gluten-free, heart healthy,
Hmm.
and vegan options. Fragrant herb garden for natural aromatherapy and relaxation, complimentary Wi-Fi, free parking, and lots of free parking,
Hmm.
lots of available parking. Four-star visitor cafe offering healthy and nutritious meal options and a buffet-style dining experience prepared by Blue Cilantro.
Hmm.
Those are all great things. Those are awesome. And the minute that you get there, you are greeted by Marchine's team, who is there to help you facilitate anything that you're in need of
Hmm.
at that point. Yes?
Indeed. And definitely you'll be greeted with a smile and definitely feel that warmth and love.
And if they're not greeted with a smile, they call you.
Yes, I do actually. We have feedback forms for that. At the end of the day, we're not perfect. And we love to hear feedback, whether it's good or bad. It's always constructive, in my opinion. And we're always looking for ways to improve. So even if you think we are doing something good, let us know because that way we can trickle it down to the main stakeholders, whether it's a patient care coordinator, whether it's a porter. It's always good to give them reinforcement and provide that support that they're doing a great job as well.
Right, absolutely. So that's from the mouth of Marchine Juman.
Juman. Hmm.
Juman, front of
Like
house
human
manager.
Juman.
Juman. Okay,
Yes.
Juman, front of house manager over at Health City. Background in accounting, master's in business administration, but packing a big punch coming from Cayman Brack, and I'm proud of that too. I'm proud of that. One of the Brackers, y'all, okay? And running this team of 7 different departments, different units, and just trying to, do as much as you can in terms of succession planning for Caymanians and just doing it every day. Proud of you.
Thank you.
No, absolutely. And that was also Tiffany Dixon Ebanks, who's the Global Sales and Marketing Manager, and she comes down from the East bearing gifts on
Ah,
some Mondays.
I'm hoping that your audience was thrilled today to listen to what Marshuni does on a day-to-day basis. As I said at the beginning of the show, it's unusual for us to do this. We usually bring the doctors, and doctors come in here repeatedly. They have different topics every time,
Yes, they
though.
do.
Different topics, so it's never the same. But you see some familiar faces all the time. So I think bringing Marshini out of the hospital, I hope your team is okay without you and managing fine. Um, but it's just a difference, and it was a pleasure to have you here, Marshini. Thank you.
Well, thank you for giving me the opportunity to speak because, as I said, this is my first time really talking on air and just discussing what I do at Health City. And it provides a great platform, I think, for the administration team to just kind of highlight what we do behind the scenes on
Well,
a day-to-day basis.
and it's awesome. It's awesome
Mhm.
that you are here because although it's really nice to have the doctors always,
Mhm.
they have a thick accent. You don't. So the listeners heard everything you said today, and they understood that. So you know what? It's always good to bring one of our own as well, and then girl power in here today. So I
Oh,
love that. I love
Yes,
girl power
definitely.
too. Yeah, and we're not too hard on the eyes. So it's nice. Thank you. Thanks so much. And it's just good to know that, young people are doing things. And you guys, we're always saying that, like, you have to be ushered in, right? And to really take over those leadership roles and do them right and take care of the next generation and I just love the continuity of it for sure. So thank you so much, Health City. Medical Mondays brought to you by Health City today, and thank you all so much for tuning in to the show. Marshine Juman.
Yes, that's
Juman.
correct.
That's right. I thought human. That's good. You tell us how to do it. That's good. As well as Tiffany Dixon Ebanks from Health City. Thank you. I just want to remind you, listeners, this afternoon that commencement at the University College of the Cayman Islands is being moved to spring in line with more traditional practices in other countries. The spring date will allow graduating students to be part of the university's celebration of their accomplishment. UCCI's 2021 commencement ceremony will be on Saturday, the 24th of April, the 2021 at 7:30 p.m. at the Sir Vassal Johnson Hall. The application deadline is Friday, the 12th of March, 2021. For all the information on commencement 2021 and to access the graduation form, visit www.ucci.edu.ky/graduation. Okay, I'm going to be making this announcement every day for the next couple of weeks just to ensure that, if you are set to graduate, that you know that it's going to be in the spring as opposed to later in the year. And those of you who know people that attend UCCI and they might not know that information, please let them know. Thank you once again for joining me this afternoon. Well, I can say that Monday is over and we made it, and hope you guys are home or almost there and that you have a wonderful evening. Ladies, thank you once again.
Thank you too,
Thank you
Catherine.
too.
We'll
Take
talk
care.
to you tomorrow. Hot Topics Tuesday. Don't you dare not tune in to Straight Talk Your Drive at 5 show. This is Catherine Tyson wishing you a great evening.